It's a global pandemic. That both creates and adds to poverty. Its stigma alone can be deadly. In the midst of HIV and AIDS destruction, countless agencies, organizations, and individuals labor to loosen the disease's grip on communities across the world. As an institution, the Catholic Church is one of the largest and arguably one of the most effective organizations in the struggle. It cares for 1 in 4 people living with HIV around the world. Yet much of its work is unknown and often misunderstood. What makes the Catholic Church so uniquely suited to respond to what many consider the public health challenge of our time? This is the second segment in the series about the Catholic Church and its response to the pandemic. Here, we examine one of the Church's greatest strengths, mobilizing communities to be part of the long-term antidote to HIV and AIDS.
There are many best practices that the Church has really driven over the past 27 years of this epidemic. Some that come to mind are the incredible grassroots mobilization of communities against HIV/AIDS. Work that the Church does on a day-to-day basis of caring for the sick, caring for the dying, ensuring that there's effective access to HIV treatments or promoting HIV testing at the grassroots level in areas where the federal government perhaps cannot reach, in areas where healthcare services or health services are just not able to reach. The Church has done an incredible responsibility in getting to those parts of society. And I think that is one of the best practices that we've seen around the world with the Catholic Church as well as other faith communities.
The Catholic Church has long recognized that communities themselves must be at the crux of any response to HIV and AIDS. Through community volunteers, the Church supports families' ability to care for its sick members at home. This home-based care system is vital as overburdened hospitals and clinics adjust to the loss of professional staff who have succumbed to the disease. And the volunteers are lifelines to those in rural areas where healthcare facilities are few and far away.
Go.
Home-based care serves another purpose. The more a community is involved in caring for the sick, the more education the community receives, the more protected it is from infection, and the more effectively stigma and discrimination are neutralized.
Have you taken your drugs?
Yes.
Huh?
Yes.
What type of drug do you take in the morning?
I take that red one and the white one,
You,
around 8 hours. In the first days, when the community knew that I was positive, HIV positive, I could see that they didn't want me to mix with them like that. And I think I was also, I also didn't want to join them like that. I was excluding myself. Like maybe I thought maybe they didn't want me to go to their homes and all that. Yes. But like nowadays, because the peer educators, they are giving us educating the community. Nowadays, at least the stigma is a bit less than it was before these past 2 years. Nowadays, people can even talk openly about HIV/AIDS in their homes, at the clinics. Yes.
first of all, think of myself. If I hadn't help, I had no help, I could die. So that's why I commit myself to help others, so that they also be as I am. So that's why I see this law as very important, so that people know they come productive again, rather than experiencing sickness, deaths, and what have you. So I feel at home and feel happy to see people, in good health, going to their fields, doing different jobs and whatever.
It is because of thousands of volunteers, such as Lawrence Cianono, that community-based care and support is possible. And with more and more households needing to assume responsibility for the care of sick family members, the Catholic Church values these volunteers as critical players in a seamless response to global HIV. At times, unfortunately, and despite numerous community efforts, many individuals and families continue to suffer from some of the deadliest effects of HIV: stigma and discrimination.
Each time I passed through town, they would say, "There is Bridget. Within no time you'll see her. Finn." I had to go out of the country, but the stories still followed me.
In our next segment, we examine the effects that stigma has on different people living with HIV and AIDS, and how the Catholic Church counteracts social isolation and injustice. Please stay tuned for our next installment of this series. To learn more about HIV and AIDS and how you can respond, visit crs.org/World AIDS Day.